Kirsten Hanson, and my intended audience is stakeholders in the healthcare system in Northern Nevada, as well as social workers and therapists. Here is my actual audience. If I can turn this around. Hello. I hope you saw all three. Here we go. The Nevada Division of Public and Behavioral Health says it's critical for Nevada to rethink the way that we conduct business and develop a plan that prioritizes chronic disease care. The traditional medical appointment model, one-on-one visits with practitioners, are no longer sufficient to meet consumer demands. One solution would be to implement a newer model known as shared medical appointments. Deanne Schumacher, who has her master's in social work and is a licensed clinical social worker in the Sacramento area, wrote a book on the topic, Group Medical Appointments, an Introduction for Medical Health Professionals, and that says that group appointments seem to be most effective for patients with chronic illnesses such as diabetes and heart disease. Shared medical appointments will improve our current healthcare system and benefit consumers by alleviating the shortage of practitioners in Northern Nevada, making the patient-practitioner relationship more equitable and combining medical care with supportive services. Our healthcare system in Northern Nevada should be providing shared medical appointments for patients with chronic illness. Our local news source, the Nevada Independent, recently reported that Nevada ranks among the worst in the nation for healthcare, listing wait lists for appointments as long, visits are short, and consumers are overwhelmed and under-supported. We have a growing population and a shortage of physicians. Here is an example of our facts on physician shortage in Nevada. As you can see, there's only 26 per 100,000 residents in Lyon County, compared to the national average, which is about 250 per 100,000 residents. In August of this year, U.S. News reported that it would take over 2,500 physicians just to catch up to the national average. We have expanded our Medicaid system about 3 years ago in Nevada, so thousands of people who haven't had insurance in the past now do, and they're seeking medical care. But because they haven't had insurance and had medical care for years, many of their problems have developed into chronic illnesses. Dr. Dale Carrison, the chief of medical staff at UNLV's Medical Center, told a reporter for the Nevada Independent that the problem is exacerbated by this expansion of Medicaid, but not necessarily caused by it. And he says, quote, "I have well-insured patients who want to see a cancer doctor and they can't get in within 30 days. This is a tragedy. How would you feel if you were told that you had cancer or some other chronic illness and it would take weeks and weeks for you just to have an initial appointment to get a true prognosis?" Consumers are also overwhelmed. I have a chronic illness myself, and trying to manage appointments with primary care doctors, specialists, therapists, and support groups can feel really overwhelming on top of my everyday life duties like kids and work and school. This is the story that many people are also facing today, considering that according to the Nevada Division of Public and Behavioral Health, almost 10% of Nevadans have reportedly been told they have diabetes. Approximately 400 for every 100,000 people in Nevada have some kind of form of cancer. And heart disease is also a leading cause of death in Nevada. All of these people are living with chronic disease and they need help. How can we improve their care and provide them with support? We should encourage our local healthcare providers to offer shared medical appointments for willing and eligible participants. Here's a diagram that gives you an example of what a shared medical appointment might look like. People in the appointment include patients, advocates or family members with the patients, medical assistant, physicians, and maybe a social worker and or therapist. In this exam room here, the patient would meet with the physician's assistant to get their vitals taken, and then also meet with the physician shortly to go over medications and any questions that they might have or concerns. And then everybody would get together in this group formation for the next 60 to 90 minutes to discuss anything dealing with their concerns about care, their chronic illness, and new research or anything else that the patients or the doctor might want to bring up. So this style combines the benefits of a support group with medical care, and it's all in one convenient appointment. The World Health Organization website lists thousands of support groups, and people are taking advantages of these type of support groups already. And for those of you wondering about privacy, the same confidentiality agreements used in the support group model would be necessary here. Nurse practitioner Mary Ann Harris, who has been successfully implementing shared medical appointments in Cleveland since 2002, said she has her patients each sign a HIPAA confidentiality agreement. And I know you might not feel comfortable, or you may feel comfortable already with the status quo. The traditional one-on-one visits have been the norm for a long time, but there are a lot of benefits to adding this new model of care. These shared appointments will shorten wait times, increase patient satisfaction, combine medical care with peer support, reducing patient obligations. A 3-year study on SMA patient satisfaction in Eastern Massachusetts says, quote, in an understaffed care system like the one that we're facing, with growing numbers of eligible patients with medical care, shared medical appointments may accommodate more patients in a timely manner. This study also found that SMA patients reported greater overall satisfaction with care. These results are also supported by the BMC Health Services research. They reviewed 71 high-quality, peer-reviewed primary research articles and produced 9 benefits of this model. They found that SMAs produce increased equity with practitioners, and in their findings, they brought together patients with lower motivation and some with higher motivation for self-management. This led to improved self-efficacy overall and better disease management between appointments. So this is the benefits of positive peer pressure that we're seeing in the shared medical appointments. They're also an effective model, and if implemented, will relieve our current chronic illness healthcare system. They improve appointment access, increase overall patient reported satisfaction, and provide supportive peer groups which positively influence patient self-management. And just in case you have any doubts, that Massachusetts study also reported that the more patients attend an SMA, the greater their satisfaction. As you can see here, from years 2008 to 2010, the darker bar shows patients who had attended one SMA, and the lighter bar includes patients who had attended multiple SMAs, and they had greater overall satisfaction 3 years running. So encourage your community health care representatives to implement shared medical appointments today.